Welcome to another episode of The Granite List Live, where we explore all things employee benefits and human capital related. I'm your host, Sally Pace, and today we're going to talk about all things DPC related. I'm joined by three fabulous people that are experts and have name recognition in this space. Alex George, who's the head of marketing at Hint Health. And we also have Molly Breitenbach, who is with Candid Health Advisors, and Dr. Brandon Alleman, who is with Antioch Med. So I know a lot of our audience knows the acronyms DPC, but will you start high level and just talk to us about what direct primary care DPC is and why it matters?
Yeah, absolutely. So direct primary care, DPC, is a model that transforms primary care. It really enables doctors to build trusting, enduring relationships with their patients. And in the DPC model, clinicians get paid a recurring membership fee for all the primary care, wellness, chronic disease management, and urgent care needs of their patients. It allows us to kind of remove insurance from the doctor-patient relationship and center it back on that patient.
Awesome. And Molly, you've had an interesting path to get to this space. You didn't go to medical school.
Nope.
You didn't necessarily major in the benefits arena. You were a CPA, right?
Mm-hmm. Yep. CPA for more than a decade. Just practiced on the assurance and consulting side at a large firm. However, I have been a member personally of a DPC for more than 8 years since the birth of my first daughter. So really love the model and just decided to turn it into my career. So definitely a roundabout way to get here.
Absolutely, but it's worked. And now you're partners with Dr. Alleman. And I'd love, from a clinical perspective, can you share what the benefits are of a direct primary care model versus the traditional model?
Yeah, I think the best way I can explain it is, and I was just telling somebody earlier today this, is really it's giving individuals and a family a medical home. So that's something that is not widely available, especially when, like Alex was saying, things are paid fee for service. We are tied to this insurance model. It's really hard to have a medical home. And it's really hard to incentivize doctors to do all the non-visit things. So coordinating care and taking phone calls and responding to text messages. So direct primary care lets family medicine physicians and primary care doctors provide a medical home and not only provide the care, but also provide direction through the healthcare space in general.
Molly, you mentioned that you were a patient before you really brought this into the space, and you guys collectively have created something special recently. Who wants to tell our audience about your most recent project?
Sure. So there's two things. Dr. Alleman owns Antioch Med, and then together, the two of us are Candid Health Advisors. And I think that Dr. Alleman's been doing this for long enough to know that, yeah, you can fix a lot with DPC, but you can actually take it one step further and actually integrate direct primary care in with a traditional employer-sponsored benefit plan. So recently, what we worked on with Hint Connect is just taking that type of plan, so an ACA-compliant health plan that has DPC embedded, and rolled it out to an employer that had multiple locations. And so that's where we brought Hint in. This particular employer is headquartered in Wichita, but they have many different locations in different states. And we know it works here in Wichita, but we didn't know if we could actually roll this out and make it work in other states. And that's where we brought Hint in to help us do that.
Do you mind peeling back the layers a little bit and sharing what some of the challenges were that you had to overcome with that?
Oh, goodness. Yes. So I think finding providers, that is certainly something, DPC is still an emerging model. It's certainly more prevalent than it was when I started, when I became a DPC patient, 8+ years ago. But finding those providers and kind of, we want to make sure that we're not vetting, because they're all high quality providers, but talking to them and making sure they understand what it is. Because a lot of times, and Dr. Alleman can speak to this a lot better than I can, but a lot of times DPC physicians enter the DPC world because they want to escape that traditional fee-for-service model. And so when you come to them and you say, well, we actually want to roll you into an employer-sponsored benefit plan, sometimes you run the risk that they're going to get nervous. And this is something that they are doing DPC so they can opt out of this model. So it's having those conversations with them and making them comfortable. Pricing, they all have different pricing. And so Hint helped us negotiate those pricing with all the providers. And then just getting everyone on the same page in terms of billing and how they're going to get paid, and assuring them that they're going to be paid timely. Cash flow is obviously a big thing with direct primary care. So just making sure that they're comfortable with the model that we're rolling out.
Let's dig a little bit more, because For folks that have not heard of the DPC model or it's new to them, there is a question around who are these providers? How are they different? So when you're talking to providers, your peers, what are some of those aha moments where they say, yes, I'm on board? And what does that mean for the patient?
I think, when we started, there was only a couple hundred practices that were doing DPC, and now there are like 2,000. And so there was a point when I knew most of the physicians doing direct primary care, and now there's just no way to have that personal relationship and know every provider that's doing that. I think lots of people starting out in direct primary care, everybody starts with individuals, so it's very easy to onboard individuals. Onboarding a group for a new DPC, especially if it's 20 patients and their headquarters in Wichita and I don't really have any relationship with the business, them hearing that another physician is part of kind of designing this benefit kind of alleviates some of those fears. And then knowing that, hey, somebody's going to help me out if I have a billing question. Somebody else is going to help me out if I have a how does this plan work question. This is a way that I don't know a physician in Pennsylvania, but Hint may already have that connection. So it's working together where we can use the physicians that I know and then also access physicians that Hint already has an existing relationship with. So that is a way that hopefully this is allowing DPCs that are getting started or already down the road on their journey add new patients without a lot of lift on their end.
And Alex, tell us a little bit more about the role that Hint played when you got invited to this party.
Yeah, absolutely. So for those who aren't familiar with Hint Connect, what we do is we really bring together a curated national network of independent direct primary care providers with a consolidated kind of enrollment technology. So everything goes along with the enrollment side. And then we have the expertise to really implement this DPC benefit. And that's kind of where we jump in. So we have a few different things that we do on this side. I think what's kind of important or kind of what we might want to take a look at here in particular is as Molly and Dr. Alleman were working with and also e-powered benefits to kind of build this plan and figure out who that network was going to be. They came to us because they knew that we had the ability to not only access our network, but also stand up and expand that network as needed. So I think when they first came to us, we did what's called a geo-analysis to see, hey, where are all of the employees, what zip codes they live in, and who can they access through our Hint Connect network. And we had coverage of about 10, maybe 12 of them at the time, but we knew that there was 5 to 7 more that we had to expand into. So what our team's able to do, which is really cool actually, is quickly kind of pivot and then go on to the offensive, if you will, and go after these other DPCs to find them and bring them into this network for this employer specifically. And so that's something we were able to do. I think we pulled, I think it was either 5 or 7 more DPCs into this plan, the specific employer, in a matter of weeks, which is just really impressive.
Yes, it is. Is this a typical engagement with the Hint Connect team for you guys, or how are the consultant world engaging Hint Connect?
Yeah, I would say it kind of works both ways. Oftentimes they'll come in and the network's already in place and they're like, great, we can tap into it. We'll work and build out a plan and just move forward with it. And then it's a little bit more focused on the implementation side of things. We have the technology for enrollment, on the billing on the back end, making sure all of the different clinicians and clinics get paid on time and everything of that nature. And then there's more of these solutioning ones that come into play where we need to build out the network a little bit more or work together with different consultants or advisors to make sure that everyone's covered on the plan.
When you talk about enrollment, are you talking about like the standard benefits enrollment or specifically the program?
This is something that's really cool about Hint Connect and more importantly, the DPC doctors themselves. And I'd love for Dr. Alleman to speak a little bit about that. But what happens is we encourage the doctors to go on site for enrollment and hear firsthand. It's not something that employees are used to, is having that kind of like touch point with their doctor before they even enroll, right? So Dr. Alleman, do you want to speak to that a little bit?
Yeah, and this group was very proactive in engaging their members. So they have, I think it was 13 sites, and they had a on-site meeting, or for some of the smaller ones, a virtual meeting for all of those. And at every one of those locations, we tried to bring the DPC that was going to serve that location into the benefit meeting. The way this plan is structured is when they enroll, they choose. They choose whether they want to have their primary care from a DPC or they choose that they want to stay in a more kind of traditional looking option. And thankfully, more than 70% of the group picked the DPC option. Well, people are going to be much more comfortable changing their location of care if I have seen the eyeballs of a physician. They're going to explain to me how this works. They're going to explain to me what the office looks like. I think we even did an open house for one of the things where they got to come see the clinic as well. And so that just really, when somebody's making a change like that, am I going to be comfortable receiving care in a different way? It really decreases the barrier on the employee side of, hey, this isn't something that my employer is trying to do to me. It's something that my employer is doing for me.
Completely. And I'm glad we dug into that because this is the first time I've heard of the bring your doctor to work model.
Right.
Pretty remarkable. That is highly unusual for those of us that have not heard about those kinds of services. So hats off to you guys for doing that. Molly, as serving in a consultant role, when you're working with employer groups, what are some of the hesitations you hear or reasons that they may not want to go down this path?
Sure. It's always the fear of the unknown. I think especially in the benefits world, it's very easy to just stay with the status quo and just hit the easy button and just go through your renewal and stick with your same vendors. It requires a lot of courage. I mean, frankly, from the C-suite and the HR department to really roll out this new way of their employees receiving healthcare. Direct primary care is always something in my mind. I'm like, oh, this should be the easiest sell. But there's a lot of education that has to happen to make people understand exactly what this is and what it means for them. I think it's funny. And I think the first couple benefits meetings I went to where direct primary care provider was actually on site, by the end of the meeting, they have lines of people just wanting to talk to them. And, they get real personal and, asking their medical questions because they want to see how that provider is going to handle it. So education is always the biggest barrier, I think, fear of the unknown, and just getting the company willing to do something a little bit different. The payoff is there. It's always going to work. It's just getting them comfortable with the idea of making that significant of a change.
What I love the most about this story is that you're really marrying high touch with high technology, which is not always for the faint of heart because both require time and commitment. So, Dr. Alleman, can I get you to kind of share a little bit more about what that looked like and what Hint Connect did to win you over?
Yeah, I think we've had other groups that will try to manage enrollment by the highest degree of technology is emailing out multiple spreadsheets to multiple DPCs. And when you have one consolidated enrollment location and one consolidated billing location, that is just a technology solution that's very helpful both to the group and then also to the people kind of helping design to make sure that everybody knows where they're getting cared for and when they're eligible for care.
I think specifically on the Hint side, we have people that they have multiple locations. This particular employer has multiple locations, and oftentimes employees will switch from location to location. So instead of, having to email and find the DPC and negotiate rates and everything like that, I mean, it's just a matter of I go in there and I change the location from a drop-down menu. So it's very easy to make those change, and then Hint on the back end fixes the billing and makes sure that the appropriate provider is paid and paid timely. So it's very easy once you get up and running to administer the benefits that way.
Absolutely. Alex, anything to share from the Hint side about the technology you guys have invested in and built?
Yeah, I think it goes back to originally why Hint was founded. Hint's 11 years old at this point, and when we first came to market with our kind of billing and membership solution for the direct primary care industry, it was all about helping to support a growing movement that was changing healthcare today. And it's amazing just to see how Hint has grown from a billing and membership solution for DPCs specifically to a larger kind of play into the employer space and bringing DPC to what we call the masses effectively, right? So it's just cool to see that the technology is growing and improved over time to be able to support that.
Well, thank you all for joining today. We are so grateful for our partnership with the Hint family. You guys are amazing and the best at what you do. So we're grateful at the Granite List to have that relationship. And Molly, Dr. Alleman, thank you so much for coming on and joining Alex to talk about the ways that you've made it approachable to really roll DPC out, like you said, to the masses, and for sharing your story today. And thank you to our listeners for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.